How to prevent colon cancer. Colon cancer is one of the most common and lethal cancers these days. Fortunately, you do get early warnings and signs to make you aware of this deadly disease. Not only elderly people but youngsters in their 20s are also diagnosed with colon cancer every year. Even though the exact cause of colon cancer is still unknown, it is believed that the accumulation of cells in the lining of the colon can lead to the development of this type of cancer. Research has found that many people don't take the symptoms seriously. Many people who had colon cancer have told that they observed the signs, but they chose to ignore them, thinking that it might be some other small health issue. Risk factors for colon cancer include obesity, smoking, family history of cancer, unhealthy diet, genetic conditions, excessive alcohol consumption, digestive problems, diabetes. Since colon cancer is the third most common type of cancer diagnosed in both men and women, it is extremely important to know all the signs and symptoms because an early diagnosis can save a person's life. Rectal bleeding is the most common warning signs of colon cancer, but there are many other signs as well. If you observe any of the following symptoms, contact a doctor and get the required test done immediately. Warning signs of colon cancer. 1. Constipation. Most people are affected by constipation because they don't take enough fiber and water. But chronic constipation that persists for weeks may be an early sign of colon cancer. The tumor present in the further end of the colon makes it very difficult to pass stool. If you feel some sort of obstruction, then it's time for you to get checked. 2. Rectal bleeding. If you see blood in the stool, it can be the indication of colon or stomach cancer. The blood can be bright red or maroon in color. Bleeding from the rectum happens with more than half people with colon cancer, and if you observe blood, do get yourself tested to find the exact reason. 3. Diarrhea. Regular diarrhea is a sign of colon cancer. As per studies, almost 1 in 5 people with colon cancer experience diarrhea. As tumor in the colon can obstruct the bowel, it also makes changes in bowel habits. Thus, if you experience diarrhea for weeks accompanied by pain, nausea, and vomiting, then consult a physician. 4. Narrow stools. This is referred to as change in the stool caliber. If the stool is much thinner than usual, it may indicate a cancer in colon. The tumor blocks the colon, which leads to release of narrow stools. 5. Nausea and vomiting. If you are facing non-stop nausea and vomiting for a long duration without any apparent reason, then get yourself examined because it can be a sign of colon cancer. Most people tend to think that it might be happening because they ate something wrong and get reluctant to see a doctor. But if the problem is persistent, you need medical help immediately. 6. Abdominal pain. Everyone faces abdominal pain once in a while, but if you suffer from this pain regularly combined with other symptoms like vomiting and nausea, then seek medical help. Also, another common symptom of colon cancer is feeling tenderness in the lower part of the stomach when it is touched. 7. Anemia. If cancer develops in the colon, it leads to a low level of hemoglobin in the blood. When tumor begins to bleed in the digestive tract, it leads to anemia due to the loss of blood. The symptoms of anemia are feeling tired all the time, pale skin, weakness, cold feet, and shortness of breath. It is advised to take a regular blood test, and if you observe lower red blood cell count with other symptoms, then get examined. 8. Fatigue and weakness. If you feel tired without doing a lot of work and feel out of breath, then it can be because of developing cancer. Extensive tumor in the colon can cause anemia, which lowers the level of oxygen in the blood, making a person weak. Also, colon cancer can cause weight loss even if you are eating properly. 9. Bloating and gas. If you are constantly feeling a little crampy, then it can be a sign of colon cancer. Although a lot of people experience the usual bouts of bloating and gas, if the problem is persisting for a long time, then it can be a reason for concern. Tumor can block the elimination of gas from the body, causing bloating. 10. Unrelieved urge to pass stool. Cancer can spread rapidly in the colon and create a massive tumor. And when this tumor grows, it stops the stool from passing through the colon normally. With people who have colon cancer, the tumor grows big enough that they cannot pass stool and have the urge to do so again and again, even after going to the washroom. If you have been experiencing this issue from a long time, then call a doctor for further examination. You may observe these signs from a long time and think that it is normal, but sometimes ignoring them can be extremely fatal for your health. If you have been noticing any of the above mentioned signs for a long period, then don't be shy to consult a doctor for help. Sometimes early stages of cancer cannot be identified, but if you had a family history of colon cancer, then it can be diagnosed with screening. For people who are age above 50, It is advised by the doctor to get colon cancer screening done on a regular basis. The symptoms of colon cancer can be different in different people based on the size of the tumor, but have mostly included changes in the bowel movements of the person. Early diagnosis can save your life. The sooner colon cancer is detected, the better are the treatment options that can be provided.